Hello, I'm David Francavilla with the Veterans Experience Office. Today we are broadcasting live from the 8th floor of the VA headquarters in downtown Washington, D.C. This is the second live broadcast of the VA Community Town Hall hosted by the Honorable Robert Wilkie, the 10th Secretary of the Department of Veterans Affairs. Today's broadcast will have three segments. The first segment will include a discussion of the state of the VA and trending topics from our last town hall, which will be led by Secretary Wilkie, and then our keynote speaker, Dr. Lynda Davis, Chief of the Veterans Experience Office. Their presentations will be followed by a short Q&A. Our first town hall last September was a huge success. Over 26,000 folks live streamed, and we received 2,700 comments, questions, and suggestions. The questions from the first town hall were quite diverse and ranged among questions about benefits, health, pending legislation, suggestions, personal issues, and requests for assistance. For our second and third panels, we've invited the chief executives over those programs to address some of the questions from the last town hall. It is not a surprise that suicide prevention, choice, care in the community, and appeals had the most number of inquiries and comments. For that reason, Panel 1's subject matter experts include the executive in charge of the Veterans Health Administration, Dr. Richard Stone, Dr. Keita Franklin from the Office of Mental Health and Suicide Prevention, and Dr. Cameron Matthews, the Office of Community Care. Our panel will share information on how they're improving customer experience, setting priorities, accomplishments to date this fiscal year, and address several of the trending topics from the last town hall. The September Town Hall also had numerous questions on dental care, beneficiary travel, marijuana, memorial benefits, customer experience, Blue Water Navy veterans, Agent Orange, and education. For our second and final panel, we requested the Undersecretary for Benefits, Dr. Paul Lawrence, Undersecretary for Memorial Affairs, Randy Reeves, and the Chairman of the Board of Veterans Appeals, Chairman Cheryl Mason. In our live streaming audience today, we have over 45,000 have registered for this event. We've invited folks from across the nation for a community forum to be part of the conversation, to include VSOs, MSOs, state and county VAs, nonprofits, academia, county veterans engagement boards, community leaders, federal and non-federal agencies, advocates, stakeholders, service providers, veterans, families, caregivers, and survivors. We're doing things a little differently today than our last town hall. Although each panel will have a short Q&A, the questions will not be live. Instead, last month, we reached out to 151 veteran community engagement boards, veterans and their families, and asked them to provide questions that reflect local and national issues and challenges that the VA is facing today. However, if you have an individual issue or need assistance, we ask that you contact your local VA medical provider or VA Regional Benefits Office. And if there are issues that you cannot resolve, please call the White House VA hotline at 1-855-948-2311. These phones are operated 24 hours a day by a VA agent. Today's broadcast will be recorded and posted on the VA VEO website post-event. Visit www.va.gov/VE as in Victor Echo. It gives me great pleasure to introduce the 10th Secretary of Veterans Affairs, the Honorable Robert Wilkie. Mr. Wilkie was sworn in on 30 July 2018. Before coming to the VA, Mr. Wilkie was Undersecretary for Defense for Personnel and Readiness, the Principal Advisor to the Secretary and Deputy Secretary of Defense on Total Force Management. He has over 20 years of experience at national and international levels. Mr. Wilkie is the son of an Army artillery officer. He is an officer in the United States Air Force Reserve, and he previously served in the Navy Reserve with the Joint Forces Intelligence Command, Naval Special Warfare Group 2, and the Office of Naval Intelligence, and he is a graduate of the U.S. Army War College. Ladies and gentlemen, VA Secretary, Mr. Robert Wilkie.
Thank you, David, and hello, everyone. And Lynda, thank you. Your VEO team is essential to keep VA marching forward, and we rely on all of you. I've seen the truth of that proposition many times over in the last 20 weeks. I've traveled to 35 cities. I've seen medical centers, regional offices, cemeteries big and small, from Tampa to Boston, New York to Oklahoma City, and Los Angeles, and even to Anchorage and Honolulu. I've talked to employees, veterans, their advocates, community service providers, community groups, nonprofits, and other stakeholders. So on behalf of all the veterans we serve together, thank you. The last time we met in September, I updated you on the state of our VA, and I told you that VA is better for a number of reasons. Recently, we received two wonderful reports. For the first time in our history, the Partnership for Public Service said VA is now one of the best places to work in the federal government. And a report from Dartmouth said that VA health care is as good or better than any care our American people receive in any part of our country. We're still improving, but more and more people are noticing, and all of you are a part of it. And some late-breaking news. The Federal Register plans to publish the Appeals Modernization Regulations on Friday, tomorrow, and VA will implement on February 18th, 2019. Appeals modernization gives veterans more choice and control in the claims and appeals processes and will result in quicker decisions. So before I take some questions, let me touch on some priorities. My single most important clinical priority is ending veteran suicide, and we're making great strides, improving mental health care for veterans through initiatives like telehealth and same-day mental health services. So let me talk about what you can do to help. We want to educate, empower, and mobilize as many of you as we can to join in veteran suicide prevention efforts. Suicide is a national public health issue that affects communities across America. So our approach to veteran suicide prevention is a public health approach that looks beyond the veteran. It brings in peers, family members, and communities so we can prevent suicidal behavior before it occurs. Right now, over 400 VA suicide prevention coordinators and their teams are connecting veterans with care and educating communities about prevention programs and resources. You'll find them at every VA medical center. So please make a concerted effort. Reach out to them. Organize your local grassroots efforts. You don't need special training to support veterans in your life. We can all do something to help. Your words could be what a veteran needs to hear, a reminder that there are many people who want to listen and to help. Preventing suicide begins with just the willingness to be there. President Lincoln charged us to care for him who shall have borne the battle and for his widow and orphan. And you're on the front lines, helping make sure there are no gaps in supporting veterans in your communities. You help by sharing your insights, perspectives, what you're hearing from veterans, and we depend on that feedback and act on it. Here are a couple of quick examples. We launched the White House VA Hotline in June, and they're doing a great job. As you heard earlier, the number is 1-855-948-2311. The hotline's part of our contact center modernization effort to ensure a consistent, positive veteran experience. And it's a veteran's direct line to trained agents who can answer their needs and concerns any time of day, every day of the year. The hotline team is good people. Nearly 75% of veterans are family members. They've fielded over 170,000 calls and emails since June, and 82% of all the cases they've received have been resolved. Veterans can expect about a 7-second wait to talk to an agent, and the calls last about 15 minutes. Just a little time could make a big difference in a veteran's life. Here's another example. Veterans Welcome Kits. VA Welcome Kits help guide veterans whether it's time to go to school, get a job, buy a house, get health care, retire, or make plans for care as they age. One veteran put it like this: I was able to readily identify how the Welcome Kit relates to where I am today. So when I go to a VSO or the VA and talk to a representative, I'll be more prepared. 2 weeks ago, we handed out over 500 welcome kits at the Student Veterans of America Conference, and they were very well received. We need to get these kits in the hands of every veteran. So now let me give you an update on implementing the Mission Act. It is the most transformative piece of legislation in the history of this department. Our new community care program will be operational this June. As part of modernization, we designed the new network based on feedback from veterans and other stakeholders, along with lessons learned from the Veterans Choice Program. It consolidates VA's community care programs and makes community care work better for veterans, their families, community providers, and VA employees. Late last December, we awarded contracts for our new community care networks for Regions 1, 2, and 3. That includes VA medical centers from North Dakota down to Oklahoma, Arkansas, and Louisiana, and from Maine down to Florida, the Virgin Islands, and Puerto Rico, a network covering 36 states. We expect to award the contract in Region 4 in about 2 months, early April, and for Regions 5 and 6 by the end of December. We are confident this new network will greatly improve customer service for veterans and the timeliness of payments to our community care partners. Replacing our aging electronic health record system is my third priority. We're connected with the Department of Defense, with private healthcare companies, and with private pharmacies in creating for the very first time an interoperable holistic record that begins the day that an American citizen begins service in uniform. I have a personal perspective on this. When I was 6 years old, I heard that my father had been badly wounded in the invasion of Cambodia. He came back to us from Southeast Asia, weighing about half of what he did when he went. When he finally retired, he left service needing 2 new knees, 2 new hips, and his body had lead from that battle in Cambodia. And he carried around for the rest of his life an 800-page paper record. When the new electronic healthcare record comes online, those days will be over. Again, my thanks to all of you and to the VEO for another great community town hall. Thank you, and God bless all of you and your families, and God bless those Americans who ensure that all of us sleep soundly at night.
Next, I'd like to introduce Dr. Lynda Davis, who's nationally recognized for her leadership in the development and implementation of significant and sustainable programs that successfully support the full spectrum of quality of life support and services for military personnel, veterans, their families, caregivers, and survivors. A former Army signal officer, she previously served as the DoD Deputy Undersecretary of Defense for Military and Family Policy. She is the mother of a veteran. Dr. Davis currently serves as the Chief Veterans Experience Officer for the VA. Without further ado, our keynote speaker, Dr. Davis.
Thank you very much. Welcome. It's really great to be with you all for the VA's second virtual town hall, as the Secretary mentioned. The Veteran Experience Office, or VEO, is honored to host this conversation with Secretary Wilkie and our VA colleagues to speak to you, our nation's veterans, and your families, caregivers, and survivors. And there's quite a lot of you out there today. We're grateful. We're also glad to have service members, nonprofit organizations, community-based organizations, and corporate partners from across the country listening today. At VA, the VEO's role is to meet the Secretary's goal to become the leading customer service organization in government, so that you, our veterans, receive the highest quality care, benefits, and memorial services. Secretary Wilkie has made customer service his prime directive to all VA employees. And for the first time in history, the VA has an explicit customer service policy, and we're holding ourselves accountable for reporting our performance to the White House, to OMB, to Congress, and to you, our customer. At the VA, our commitment to customer service starts with listening to your voices and taking action on your requests or your recommendations. We listen in very many ways, through the White House VA hotline that the Secretary referred to, through real-time surveys called V-signals, through contact centers, through our trained employees and providers, and perhaps most importantly, in face-to-face interactions with you in our hospitals, our regional offices, and through engagement forums like this and meetings in your towns and cities with our CVEBs. Based on your feedback, we also have created, as the Secretary referred to, the VA Welcome Kit. This offers clear and accurate information to help you and your families access the care and benefit services you need and more. And as the Secretary referred to the importance of mental health and suicide prevention, today we have in that kit for the first time our Mental Health Easy Quick Start Guide that you can use to find out how, in fact, to talk to your colleagues and veterans in the communities in which you live. These kits are not only distributed to transitioning service members in DoD courses through the TAP program, but they're also distributed to veteran service organizations, as the Secretary said at Student Veterans of America recently, to State Department of Veterans Affairs, VA facilities, our community veteran engagement boards, and to the offices of members of Congress to assist them in their constituent service work with you in their districts. As the Secretary mentioned, the White House VA Hotline is another way we listen. It is the VA's first 24/7, non-clinical, non-emergency listening post with warm handoffs to our veteran crisis lines and our homeless call center. In its first year of operation, it did have over 170,000 calls and emails. These were usually answered, as the Secretary said, by veterans and within 7 seconds. 44% of the hotline's calls were general information questions to help you get the information quickly to be able to locate the services you need. 54% were concerns that a veteran or a family member shared directly. These were about care or benefits. When we receive those, team members in our administrations get notified and they can take action quickly to address your needs or those of your families with a service recovery activity. When you talk, we listen, and the feedback you provide us is driving positive customer service change at the VA. In the past year, another way we've listened is through our Veterans Signals surveys. About 12 million of you received surveys or volunteered to receive surveys last year. We also listen to the responses of those surveys. More than 2.5 million of you actually submitted a survey and provided us feedback. And that feedback helps us better understand the effectiveness and emotional resonance of your experience in areas like VA outpatient services, telehealth services, our VA contact centers, and with the Board of Veterans Appeals. 68% of the surveys that came back to us related to Veterans Health Administration were actually compliments to staff about the care you received. 18% were concerns, and those concerns, as I mentioned, now immediately are referred to staff to help them address your needs. Because we're listening and learning from you, last year, 92% of all VA medical centers improved their trust scores. That's something we're very proud of. You also told us that VA hospitals were sometimes confusing and hard to navigate. So again, we listened, and we standardized a program called the Red Coat Ambassadors. They're there to answer your questions. You'll see them in the entryways in the hospitals. They're there to make sure you have the information you need and not get lost. We also trained more than 55,000 employees in our Veterans Health Administration on a new customer service approach called Own the Moment. This training and the Welcome Kit with its quick start guides will give you and your family members useful information to help you access not only health care and mental health services, but also education benefits, and give caregivers, too, a faster way to find assistance. The best part of these kits is that they're available to you right now. You can read them, and you can even print them online at home through va.gov/welcome, or, of course, you can just Google VA Welcome Kit. So these and other customer service improvements are focused primarily on the delivery of our services in our hospitals, regional benefit offices. But we know that what you also need is the support of neighbors and friends and organizations in the towns and communities in which you live, study, work, and play. As veterans, family members, veteran caregivers, and survivors ourselves, we know that your lives, like ours, are fullest when the VA and community groups and provider organizations and nonprofit and faith-based organizations work together to provide you the resources to share information, connect local providers, and to build a partnership that enables us together to offer you a positive experience. These partnerships also involve working with our sister federal agencies like the Department of Defense, Labor, and Health and Human Services to better support you in things like career choice, workforce, and in your request for more options for home care. For instance, our Choose Home initiative is collaborating with the Department of Health and Human Services, their Administration for Community Living, and their extensive national-wide network to bring you additional resources at home. Closer to home, we continue to build on the momentum of our Community Veteran Engagement Boards, or CVEBs. These, as you know, are grassroots collaborative networks that help improve your lives locally. We now have 151 of these CVEBs across the country, and the growing numbers are every day getting larger. We officially added our newest CVEB in El Paso, Texas, so welcome El Paso. You have joined other active and successful veteran-friendly communities like Arizona's Be Connected, a statewide program which focuses on reducing veteran and military suicides. Also the Martinsburg, West Virginia CVEB, which partnered to put on the first Veterans Day parade in nearly 50 years. And the United Veterans Coalition in Denver, Colorado, which works with key institutes to better serve veterans with traumatic brain injury and their families. Those CVEBs and others that are already meeting your needs in your communities, we say thank you. And the VA wants to be an integrated part of your activities and solutions, especially for pressing issues like mental health and suicide prevention, as the Secretary mentioned, and as you'll hear more from our panel later on. We're also listening to the voice of family caregivers, survivors, through our new Veterans Family Caregiver and Survivor Advisory Committee, the first ever, chaired by Senator Elizabeth Dole. We invite you to share your comments with the committee by visiting va.gov/advisory. Please continue to talk to us if you are a family member, survivor, or a caregiver. Tell us what's working and tell us what's not working. Call the VA White House hotline. Take our surveys, share with your providers and other VA personnel, and get involved with the local CVEB. As the Secretary said, for VA, this is not a time for business as usual. We are all committed to changing VA's culture to ensure that everything we do is centered around delivering an exceptional experience to you, our customer, and to those who love and support you. Thank you for joining us today and for working with us to ensure we're listening and learning to improve your veteran experience.
Thank you, Dr. Davis. We're now going to take a few questions that we collected from our Community Veterans Engagement Boards over the last month. Mr. Secretary, the first question I have for you is, based on your 5 months as the Secretary, can you provide an overall assessment of the VA and what surprised you?
Well, thank you, David. Before I answer that, I mentioned in my remarks that I think one of the great ways to describe what we mean to the country is that we make sure that veterans are able to remind their fellow citizens why their fellow citizens sleep soundly at night. And part of that veterans experience is remembrance of times gone by, of history, of sacrifices that have been made to make us what we are today as Americans. And I would be remiss if I did not say that today marks the 28th anniversary of the beginning of Desert Storm, the first major post-Cold War encounter. 500,000 Americans were deployed to Saudi Arabia and to liberate Kuwait. We led a coalition of 40 nations to restore the sovereignty of a small nation that had been devoured by a very voracious tyrant. So I want to say we need to remember that time. We need to remember the 292 Americans who did not come back from that conflict. And we, again, honor all of those who have served and continue to serve. I'm going to tell you what I said to a joint House and Senate committee the week before Christmas, when I said that I am here as the Secretary of the Department of Veterans Affairs to praise the federal workforce, to praise those who work in the Department of Veterans Affairs. You have the most noble mission in government. You care for those who have borne the battle. The biggest surprise to me is that wherever I've gone in the country, I have seen people dedicated to that mission. And I believe it's part of my job to make sure that the rest of the country knows that. I was happy to go on television today to say that very thing. I mentioned in my remarks that we have been the beneficiary of two great studies from December. The first is on our health care, telling America what you and I already know, that veterans choose VA because VA offers medical care that is as good or better than any a veteran can receive anywhere in America. But the second part of that is really the testament to you. For the last 20 or 30 years, VA has always polled in the bottom 16 or 17 of federal agencies when federal agencies report about the best places to work. That's no longer the case. You're up to sixth, and you'll be higher when the next survey comes out. That shows me that there's a new day here, that people are confident, that people are happy and confident in the future and the way forward, what is coming with the Mission Act. My charge to you, though, is that no matter what happens outside of our walls, we have to talk with each other, not to each other, but across compartment lines. But the other thing that I urge you to do is something that all of us who come from the military world are taught from day one. I want you to walk your post. I want you to talk to your fellow employees. I want you to talk to veterans. I want you to get their impressions. I want you to get their opinions. We're doing that here in the headquarters. Expand your aperture when it comes to your own VA experience. If you're in VHA, find out what VBA colleagues are doing. If you're in VBA, walk over and see what our cemeteries and memorial affairs are doing. That way, you can come to the table with a better customer experience for those we are chosen to serve. So I could not be happier. I could not be prouder to be what I've said is the temporary custodian of the flame that all of you have taken an oath to carry for the rest of your lives. So that's a pretty good affirmation of what's going on here.
Yes, sir. Thank you very much. And it's hard to believe that over 2 decades have already passed. Seems like just yesterday.
It does.
The next question we have is for Dr. Davis. I'm a county veteran service officer, and I received a folder with a hard copy of the VA welcome kit that you spoke about earlier. How do I get more copies for veterans that are transitioning into my area? If the welcome kit is online, please let me know how I can access it.
Well, thank you very much for that question. The Secretary referred to this. For those of you who went through the transition assistance programs, you remember probably getting too much information, and also the handouts you did get were more like the Federal Register, very hard to digest. We worked with veterans, and they told us what was important to them to hear and how they wanted to hear it. Getting information on websites, phone numbers, names of people. So we created the welcome kit, and as I mentioned, it has these quick start guides, 2 pages that show you exactly how to access the benefits. We have education benefits, we have health care, we have mental health services, and we have one for our caregivers. The best way to get those is to come to some of our conferences and conventions. We hand them out, or to your VA hospital. But you can get them right away yourself in your home with that convenience. And that's to go to the website www.va.gov/welcome/kit. And that's way you or your organization, your CVEB, or an employee who wants to be able to answer questions quickly in an area that they may not yet be as familiar with from a sister administration, you can go there and get the information and download it right away.
And I know, Dr. Davis, in Colorado, I've handed out several of these, and the veterans have received them very well, very informative.
Yes.
We have time for just a couple more questions. The next one's for the Secretary. What is the VA doing for the women service members and ways to reach them?
Well, let me validate what a couple of United States senators have said about me, that I'm sort of like Forrest Gump when it comes to using history to answer a lot of questions. When my father was commissioned, 2 months before President Kennedy was inaugurated, less than 0.5% of the force was female. When I became Undersecretary of Defense in 2017, I was responsible for a force that was 17% female. So what does that mean for the Department of Veterans Affairs? It means this is not your granddaddy's VA anymore. 10% of the veterans we serve now are American women, and we've had to change with the times. So now there's at least one women's health professional in every one of our VA medical centers. We're expanding that aperture. We're providing things like maternity services. We're providing things like mammograms. We are looking to the health of our American fighting women and changing the very face of VA. My guess is, having come from the Department of Defense, that the number of American women veterans will only expand. I'm thinking that by 2025, 20% of the active force will be American women. And because of that, we will continue to change along with that population. So I expect actually I will not say expect, my priorities when it comes to hiring people to serve our veterans fall into just a few categories. One is primary care, sort of the wave of the future. The second is women's health, and the third is mental health. We need to get the talent to serve the population of the Veterans Affairs Department as it exists now, not as it existed during my father's time, but as it exists now. And we will change with the times, and I'm very happy to do it.
Outstanding. And then our final questions, and this one's for Dr. Davis. I have suggestions for the VA. They're not complaints. Normally I would go through the White House VA hotline, but how do I make these suggestions known? Who do I talk to? Who do I contact?
Well, thank you, David, and thank you for that question. There are numerous ways, as I mentioned earlier, that we do listen. And I would encourage you to use the hotline, even if it's not a crisis, but you have a concern about yourself or the service received by someone else. If you have a compliment, which are always appreciated, or you have a recommendation, you can help us improve our services. And the one thing beneficial about the hotline, which the number I'll repeat again is 1-855-948-2311. The one thing is, all of the calls are the information, the content, not the call itself, but the content is recorded, and it is then shared with each of our administrations that the Secretary referred to. So we have a record. Is it an individual veteran that needs attention, or is it a series of veterans that guide us in program improvement? If you have this, it's a way for us to hold ourselves responsible to responding and get that response rate to 100%. Of course, if you do get a survey whose numbers are increasing in different areas in the VA, including through the cemeteries and the Board of Veterans Appeals, please answer those. You can answer quantitative questions on scales, and you can also provide open-ended text and comments, and we do analyze those, and that helps us improve our customer service. And finally, talk to your providers. They are willing, or if they're not, someone will be willing of one of their colleagues to make sure they have the time and the attention that you need to understand how we can better serve you. At the very least, if you need to reach us, you can email me at lynda.davis@va.gov, and we will respond. Thank you.
Well, it looks like about all the time we have. We're going to show a few short video clips of the VA welcome kit and public health video on suicide prevention. So don't go away. We're going to be right back. Panel 1 is coming up next.
For the first time since the fall of Saigon in May of 1975, more than half of our veterans are now under the age of 65. That means they are computer savvy. They want service that is closer to home. They have very different expectations. So, the first commandment, my prime directive, is customer service. Customer service is what our Veterans Experience Office team is about. VEO is about listening to veterans like you and then making improvements based on your feedback. VEO is here, the conference, handing out its welcome kits. They're designed specifically for student veterans. We tested them last year at your conference in San Antonio. We redesigned them based on your feedback.
Welcome to the VA. Let's get started.
It looks bright, easy to read.
Well, this is helpful because you'd be surprised how many people do not know how to apply for disability rating.
I was able to readily identify how this relates to where I am today.
A little one-stop shop here.
I'm like this handout where it's like a step-by-step guide. I feel like that would be really effective in getting them to apply for the benefits.
And this is how the actual document's going to be set up.
This is it.
Perfect. Let's see.
I think most times you think from the government it's going to be look like a tax form or something like that. So this is colorful, more inviting. Again, probably easier to understand.
So when I go to a VSO or the VA and talk to a representative, I'll be more prepared.
I think it'd be cool if the VA actually linked up with all the branches and started giving this out whenever their service members are separating, you know?
The welcome kits can help guide you, whether it's time to go to school, to get a job, to buy a house, get health care, retire, or make plans for your own care as you age. I want to thank you for being part of the team here at VA, being at the table with me and the leaders as we chart a new course for this, the most noble of federal departments.
Welcome back. It's with great honor that I present to you the first panel. Discussion will focus on VA priorities, trends from the last town hall, and important topics such as community care, choice, and suicide prevention. I would like to introduce our distinguished panel. Executive in Charge, Veterans Health Administration, Dr. Richard Stone, Office of Mental Health and Suicide Prevention, Dr. Keita Franklin, and Office of Community Care, Dr. Cameron Matthews. Now we'll hear from Dr. Stone, Executive in Charge, Veterans Health Administration. Dr. Stone?
David, thank you very much, and good afternoon, everyone. And I look forward to the questions that we had last time. Were just great, and I look forward to answering some great questions again. Let me take the few minutes that I have to talk about a couple of issues. This morning when I left my home, I was one of more than 341,000 Americans who call themselves employees of the Veterans Health Administration. We're all very, very proud of what we deliver, and you heard the Secretary talk about a recent study released by some of our health colleagues that identified that in virtually every one of the markets that we operate, we either meet or exceed the quality of health care in America and in those markets. Healthcare workers in America are in great demand. In fact, in any given year, about 18% of healthcare workers in America change jobs. But yet in the VA, only about half of that leave us and move to other jobs, about 9%. We actually retain our employees at double the rate as does the rest of American healthcare. That's true of our nurses. We employ 95,000 nurses in VA healthcare. We're the largest employer of nurses in America. In the rest of American healthcare, almost 17% change jobs every year. In the VA, that number is about 7.5%. Now, why am I making this point? I'm making this point because it's hard for us to keep employees. And when we have a good workforce, a solid, well-trained workforce, a workforce of 341,000, which is 14,000 more than we had 2 years ago, we can offer access to health care at unprecedented rates. You know, last year, in calendar year 2018, we did more than 58 million appointments with veterans. That's 3.7 million more than 4 years previously. In addition, we were able to cut down the wait for urgent appointments dramatically. The cut for, in 2014, urgent appointments took about 19 days. Last year, it took under 2 days, and we continue to get better. Now, why do I make this point? Last weekend, a major Northeast newspaper wrote an article that there was a secret plan to privatize the VA. There is no such plan. We are investing in, we are growing, and we are trying to restore trust in VA healthcare. Now, when that sort of article is written, that sort of article is then propagated across American media. It creates fear and trepidation amongst our 341,000 brothers and sisters that call themselves employees of VHA. Let me reassure you that if you're an employee of VA, there's no plan to privatize. Your job is safe. Stay with us. Secondly, if you're one of the 3,000 people that will interview this month to hire, and you're thinking about whether to quit your existing job and come to the VA, this is a great mission, and this mission will continue. We've been here more than 100 years, and will continue to be here. Now, we recognize that under the Mission Act that the Secretary mentioned, there'll be enhanced choice for veterans to make decisions on where they're going to get their health care. There's enhanced eligibility. But we know from multiple years of experience that our over 40-mile veterans who live in rural areas more than 40 miles from one of our facilities, that they have had a choice for years on where to go for health care. more than 90% of them have chosen to stay with us. And of the 10% that choose to go out to commercial healthcare providers, the vast majority go once and then come back to us. About 99% of those veterans are still with us. So if you're a healthcare worker thinking about joining us, join us, we're going to be here. Secondly, to my 341,000 fellow employees, 2 of which are to my right, stay with us. We're proud of what we do, and we'll continue to be there for you. Thank you very much.
Great words, Dr. Stone. And next, I'd like to introduce Dr. Keita Franklin, Office of the Mental Health and Suicide Prevention.
Hi, I'm the Executive Director of VA's Suicide Prevention Program, and in this role I provide guidance to our enterprise as well as the nation on preventing veteran suicide, and I'm so happy to be here with you this afternoon to speak with you. You know, I wasn't here for the last town hall, but I did have the opportunity to review all of your questions and look forward to answering more today. Let me just say how thrilled I am that our veterans have so many advocates like you to support them. Here at VA, we know that we can't end suicide alone. Each day we work with partners across the country to reach veterans where they live, work, and thrive, to connect them with resources and care. VA is a leader and an important piece of the puzzle, but suicide prevention happens through friends reaching out, through communities providing spaces for veterans, through HR departments understanding veteran culture, and through families recognizing signs of crisis. I also want you to know that we've heard your questions and concerns about VA services, and we're actively working to ensure that we are providing a gold standard of care. We've made a lot of improvements over the last year, and especially when it comes to access to care. We've worked to build access into same-day services. We've opened access scheduling where unscheduled clinic times are reserved to meet with veterans requesting to be seen by a mental health provider. And we've committed to hiring an additional 1,000 mental health providers by the end of June of 2019. We're working to expand access for those who can't get to a VA facility through telemental health services. We've made more than 593,000 visits on telemental health alone in 2018. But you know, none of that matters if veterans don't feel comfortable reaching out for help. So we're also designing environments and resources that work for veterans, trying to help people find the right care and resources at the right time before they reach a point of crisis. For example, we know that former service members with an other than honorable discharge are at higher risk for mental health issues. Through recent legislation, VA has received authority to provide mental health care for as long as needed to certain former service members with other than honorable discharges, including those who were on active duty for more than 100 days and served in a combat role, and those who experienced sexual trauma while serving. Under authorities that existed prior to this new legislation, VA may also treat former service members with other than honorable discharges and mental illness presumed to be related to their military service. And VA medical centers are also prepared to offer emergency stabilization care for former service members who come to the facility with an urgent mental health need. We are thankful for the great support of this initiative through the current administration and the Congress. And we're also trying to understand other high-risk groups through programs like standardized suicide risk assessments, safety planning in emergency departments, and taking deep dives into our national data sources. This past year, we released the largest analysis of VA suicide rates for 2005 to 2016. And we've used that data to inform our suicide prevention efforts. You know, we have accomplished a lot in 2018. I'd like to take a moment just to share a little bit about some of that with you. We stood up a national campaign to educate and equip our staff on the latest public health strategies. We've established more than 30 formal partnerships and dozens more informal to help leverage suicide prevention. We've also partnered with the Substance Abuse and Mental Health Services Administration to launch and expand a national Mayors and Governors Challenge to help 24 city and 7 state governments outline the steps to address veteran suicide locally. We're pretty excited about this program, and in part because it impacts so many of you that are listening today. We're training providers in each of these cities and states, and we're actually putting pen to paper on concrete local plans to improve mental health and suicide prevention care. So before I hand things back over to you, David, I just also want to make sure everyone knows about our BeThereForVeterans.com. This website is full of great community resources like a nationwide resource locator, toolkits, information for families and loved ones, videos, and more. I encourage you to visit the website to look for more ways that you can be there for veterans in your community. I thank you so much for your time today, and I look forward to participating in the Q&A later.
Thank you very much, Dr. Franklin. We're now going to hear from Dr. Kameron Matthews from the Office of Community Care.
Thank you, David. I'm grateful for the opportunity to share with all of you today our vision for veteran community care. Historically, VA has maintained many different community care programs to provide eligible veterans with the care they need when and where they need it. Programs such as the Veterans Choice Program exist today for veterans to receive such care. However, the multiple programs and eligibility requirements are confusing for veterans, community providers, and VA staff. In June 2018, landmark legislation, the VA Mission Act of 2018, was passed, and that it makes dramatic improvements to how veterans receive community care. Under the new legislation, we are bringing many of the separate programs under one umbrella. We're creating this consolidated program so that it is easy to understand, simple to administer, and most importantly, meets the needs of our veterans and their families. Our vision for community care, as seen here on this slide, is to achieve personalized, integrated, and high-quality care for our nation's veterans. The aim is to create a single, high-performing healthcare network. Whether a veteran chooses to receive care directly at a VA facility or with one of our community providers, we will ensure the care will be of the highest quality and adheres to patient safety standards. To ensure integration of care within the network, we will continue to work with all of our partners, including Department of Defense, federally qualified health centers, tribal health service facilities, academic affiliates, and other local community providers. We are making historic improvements to veteran community care. Here on the slide, I've highlighted some of the key changes. With the new authorities in the Mission Act, we are increasing access to care with more transparent and simplified eligibility information. So veterans will have clearer information on when, where, and for what they can receive community care. Under the new program, we're establishing new customer service programs, including online portals. These communication mechanisms will provide veterans with quicker and more comprehensive responses to concerns and issues. We're also investing in new IT systems and infrastructure upgrades. With more standardized communication and seamless information exchange between VA and community providers, VA will be able to better coordinate care with our partners, resulting in improved continuity of care and outcomes for veterans. A major component of the new program is the Community Care Network, a high-performing network of licensed healthcare providers that will cover the majority of the medical benefits package. As the Secretary mentioned earlier, VA recently announced that it had awarded a contract to Optum Public Sector Solutions, Inc., part of United Health Group, Inc., for the management of regions 1, 2, and 3 of our community care network. These regions include the states along the East Coast and the Midwest. We are excited to partner with Optum as we continue to expand and institute better processes for a robust network of high-performing community providers. We are modernizing how we refer to veterans to the community by implementing new software that the community providers can use. We are also changing our provider payment system to enable faster payments. By being a better partner with our community providers, we hope to encourage more providers to join us in our mission. The upcoming changes to veteran community care are the most complex and far-reaching in recent history for us here at VA. We are maximizing this opportunity to create a program that delivers world-class, seamless, and personalized veteran experience. We look forward to working with veteran service organizations, community providers, and all of our other partners as we continue to make improvements to veteran community care. Thanks, David.
Thank you very much, Dr. Matthews. Now we're going to start a little bit of our Q&A. As we stated previously, our new network of 151 community veterans engagement boards were submitted the opportunity to ask us questions. And the first question for you is, Dr. Matthews, can you give us an update on community care program? I'm so very glad you offered this town hall event. I shared that you were having this town hall with many organizations outside of the VA whom also serve veterans in an effort to further collaborate and build relationships between us.
Thanks, David. I know that this is a topic of great interest, not only with the last town hall, but we're regularly hearing both positive and negative feedback about the focus and history of how choice and community care is moving forward. We are excited. Again, the Mission Act allows us to consolidate our community care programs and make it more an efficient set of processes. But the important part that we are stressing moving forward is the improvement of customer service for our veterans. We have to be able to provide this without any glitches in the system, homes. There needs to be an understanding and transparency of how they can access community care. But most importantly, the veteran must be at the center, and that is the focus with our new IT solutions, with the way that VA will be assisting the veteran in receiving that care. We want the VA to remain the focal part of how the health care is delivered, but working in partnership with the veteran so that as referrals are made, as appointments are scheduled, the veteran's input is taken into account, and that most importantly, their health care, their whole health is preserved.
And I understand also that many of the hospitals will be helping along with referrals and authorizations as part of the new process. Is that correct?
Yes, yes, very much. As I mentioned earlier, we've definitely not been as good of a partner as we could have been with a lot of our community partners, hospitals that we work with very closely. This partnership with our community providers is necessary to take care of veterans. The ability for a VA to communicate with them is a critical piece to that. So we'll be working even more closely. Again, new IT solutions, new procedures to make sure that they are considered part of our efforts.
Good news. The next question I have is for Dr. Stones. Will the availability and use of home health and support services be increased to decrease the need for hospitalization and/or facility placement for those veterans with chronic health issues?
David, this is just a great question. We know that many of our veterans, as they age, as they develop very complex problems, they really just want to stay in their home. They do not want to be institutionalized either in an acute care hospital or a chronic living facility. Even though those are excellent places to receive care, they want to stay home with their family. We have today about 57,000 elderly veterans who we're caring for in our home-based care program. That home-based care program has done just a great job of keeping those veterans in their homes with their families. It looks like they have reduced hospitalization days by about 75%. It also appears that medication usage has gone down dramatically. So we believe that this is the future of healthcare. We believe that this is the future of healthcare and will expand dramatically beyond just our elderly veterans to other compromised veterans that need care. And as we implement some of our caregiver programs, as we expand those beyond just the post 9/11 era, we think that will allow us an opportunity to really take a look at veterans in their homes and really expand this more dramatically. So the answer is yes.
Great. Next question we have is for Dr. Franklin. How does the availability of participating mental health care facilities look across the country and in rural areas for both mental health and medical care availability?
This is such an important question, David. I'm pleased that somebody provided it, because it provides an opportunity just to talk about how difficult care can be when you're in a rural area. You know, my father lives in rural Maine, so I know this phenomenon quite well, and we're doing a lot to enhance our care in these areas. One of the first things I would want folks to know about is our telemental health, and I mentioned that in my opening comments. We are expanding telemental health at a rapid rate, but you know, telemental health alone will not solve it. We continue to worry about areas that have internet issues and bandwidth issues and the like, and so we're also partnering with agencies like Given Hour, like the National Association of Mental Health, NAMI. These are important partners that also help us in this fight in the rural area. Other than that, I would just also want to make sure people know about transportation issues. You know, we hear a lot about veterans that live in rural areas struggling with transportation, and that being a barrier to care. And you know, transportation should never be a reason to not get good quality health care. So, you know, if there is a veteran out there watching today, or a family member even, know that if transportation is an issue for somebody in a rural area, they should contact their local VA, because every VA across the nation has a transportation program where they partner with VSOs and with volunteers, and they have access to vehicles and access to ride programming. So healthcare delivery in a rural community is difficult, but it's not impossible. And we're making great strides, and we've always got more to do to improve on it. But you know, we've come quite far already as well.
I'm from out west, and there's
Okay.
a huge distance, hundreds of miles sometimes between VA and AC, so that's good to know. Contact your local provider, VA provider, and see what they can do to assist in transportation to the hospital. And
I was
please.
going to add, actually, David, so the purpose behind community care is to supplement the care that we're providing in the VA so that our veterans don't have to travel those long distances, especially in urgent settings, but then also just for the reasonableness of having their health care close to home. So our networks will adequately, more than adequately represent the needs of rural veterans so that they can receive care closer to home. Our processes will make it easy so that they can access that care. That's definitely been a very large concern in the past. The confusion on how you even initiate community care, all of that information will be more easily found through websites, through a lot of the information that Dr. Davies actually recommended earlier. But even more so, we are changing the rules, at least by the Mission Act. The Secretary will be making decisions on how the eligibility for community care looks moving forward. It will be different from the choice program. We will have a better understanding of how to really address the needs of veterans with these new rules.
And I think, Cam and Keita, I think we're very, very respectful of that expanded eligibility. But respect the fact that veterans will decide where they want to go and where they have confidence. And you know, today, almost 90% of veterans that we treat say to us that they have confidence in our care and are respectful of the fact that they feel we understand their conditions at a much greater level than some of the commercial partners. And so we also worry, David, a lot about the future of the commercial healthcare systems out in rural areas. You know, it's one of the major problems in America today is small hospitals in rural areas trying to stay in business. And we think we may be the most stable piece of that delivery system. And by providing transportation, by creating linkages in our Mission Act eligibility in our community care program, I think we'll go a long way towards protecting America's veterans and maybe being a model for the rest of American healthcare.
Amen. So the next question we have is for Dr. Matthews. Sure. The community care program was put in place in case an appointment was more than 30 days out, yet it takes 60 days to get an appointment approved. Can someone explain how this helps us? What can we do about this?
Yes, this really goes to the point that I was making about a lot of our processes. Unfortunately, there's some inconsistency on how different procedures and expectations of how appointments are scheduled and how quickly issues are addressed ranges from facility to facility. We are moving forward with those new processes and trainings in order to make sure that, again, the veteran remains at the center and that the healthcare is coordinated in a timely fashion. The concept, unfortunately, of approval still exists. That care does need to be approved, but that's because we're a partner in this effort and we're assuring that the care that the veteran gets is necessary. So we will be improving those efforts and working with facilities and veterans in order to do so.
Outstanding. Dr. Stone, the next question is for you. My question, does the VA plan on increasing the hiring of chiropractic doctors to do at more facilities to help us veterans with some of the same issues that I have? And not me personally, but the person that asked the question.
So the person that asked the question, I don't know what health problems you have, but it's a great question. And the short answer is yes, we're adding more chiropractors. We recognize the fact that chiropractic, very similar to a number of other areas, included battlefield acupuncture, the broader acupuncture that's available, Tai Chi, other types of yoga therapy, dramatically reduce the amount of pain that veterans can have and keep veterans moving. You know, we just took a look in our chronic living centers, our nursing homes, In our CLCs, in 130 of them, 48% of veterans complain of chronic pain. If you look across all of American nursing homes outside of the VA, the number of patients with chronic pain is about 5%. That is a result of our service. And I spent 23 years in uniform, both in the active and in the reserve components. All of us that have served in uniform know that there's a price that we've paid, and part of that is chronic pain from backpacks and lugging through our training and mountains and our combat time. So that said, chiropractic is an essential piece of trying to reduce the dependence on pain medications, and secondly, reducing chronic pain and keeping our veterans moving. So the short answer, yes. The long answer I just gave you. So.
Well, it looks like we're running out of time. I have time for one more question. And because it's one of the Secretary's highest priorities, Dr. Franklin, this question kind of touches your heart. We all very much wish to do all we can to help veterans, including veterans in distress, and to intervene before they proceed to completing a suicide. We also know that the statistics of suicide related to the number of veterans who are enrolled in the VA, who have attempted to do this. What can we do as individuals to help our community and our veterans in our community?
Yes, thank you so much. And I think sometimes people think that there are very complex things that need to happen because suicide is a complex issue. But you know, one of the most important things I would recommend for people listening or dialing in today is just this idea of being there for veterans, being there for them every day while they're doing well, while they're struggling. They need you, and it's everyone's business when we're trying to prevent suicide, and we know that human connections is an important part of saving lives. And then I would just tell you to just learn the risks. We have a SAVE training for our VA employees. It's on our TMS platform, but it's also on a forward-facing platform as well. We developed it in collaboration with one of our partners, PsychArmor. But this training, it teaches people the risks of suicide. And when you watch it, I just have to tell you one piece of it. One of the most important pieces on the training is they teach people about this myth. There's a myth in the field that says if you talk about suicide or mention it to somebody, you will have given them the idea, to end their life. And it's absolutely a myth, because on this training, people learn that the most important thing you can do for somebody that might be struggling is to ask them the question, are you thinking of ending your life by suicide? And they teach you how to ask that question. In part, it can be scary. It can be really scary asking it for the first time, but be prepared for the answer. So take the training either on psycharmor.org or on our own internal platform, learn the risks, and be prepared to ask the important question. And then lastly, I would just share our crisis line number. I would offer even today, if everybody on the town hall could take out their phone and put the number into your phone and just label it Veterans Crisis Line so that everybody has it. And I have to announce it, just if that's okay. The crisis line phone number, the Veteran Crisis Line, it's 1-800-273-8255. If people put that in their phone and label it Veteran Crisis Line, you press 1 for veteran. And if we really wanted to go above, if folks could send that out to 5 people they knew. So put it in your phone today, send it out to 5 others in your contact, send it out to even more if you would. But having access to that Veteran Crisis Line, that is a capability that can save lives and is an unbelievable resource for people when they're really struggling. So I don't know if you have something else, sir.
No, I honestly, I think suicide is about intense isolation. And your friendship to a veteran,
yes,
your relationship to a veteran is the most protective thing that can happen. Yeah. And all of us have the Veteran Crisis Line number in our telephones. It is scary to ask this question, but none of us that have served don't recognize the fact that there's intense problems that can occur many, many, yes, many years later. But it is about avoiding isolation, and if you're there for that veteran, that's what's most important. But Keita, I think whatever words I have, you said it beautifully. So.
Thank you.
So Dr. Franklin has proposed a challenge to
yes,
those listening. If you would enter it into your phone and share it with 5 people, that would be a great step. I don't often know what to do with certain situations such as suicide, but there are people standing by that do, that can help.
Absolutely.
So it looks like we've come to the end of the Q&A. I'm sure there's a lot more we could answer, but thank you very much. And while we transition to panel 2, you will view a video on the VA's Ambassador Program and the VA's Memorial Benefits. So stay with us, and we'll be right back.
We were pioneers for the Red Coat Ambassador Program. We started out with a mindset of getting away from the information desk to a concierge concept. And that program allowed us to meet our veterans where they are, not just at the desk, but throughout the facility. And what we have found and heard from our veterans is that they love walking in the door, knowing that they're going to get the same people wearing a red vest, there to greet them, there to assist them.
A Red Coat Ambassador is a person who's out front. You know, he's going to engage with the veterans in every situation. They show love, compassion, kindness. We show empathy. We really try to show the veterans love as we escort them to their daily schedules.
What I believe that we've done with our Red Coat Ambassador Program, through the services we provide to our veterans, we allow them to navigate. We make it easy for them, but when they leave our facility at the end of the day, we believe they feel valued as a customer.
Welcome back. It is with great honor that I present to you our second and last panel. The discussion will share information on how they are improving customer service experience, priorities accomplished this to date for this fiscal year, and addressing the trending topics from the last town hall to include benefits, claims, memorial fairs, and appeals. Undersecretary for Benefits, Dr. Paul Lawrence, Undersecretary for Memorial Affairs, Randy Reeves, and Chairman of the Board of Veterans Appeals, Cheryl Mason. Dr. Lawrence, over to you, sir.
Thank you, David. Let me begin with some housekeeping. Nobody can imagine our world-class healthcare facilities being closed, but one of the questions I'm getting during the government shutdown is VBA open for business? And the answer is yes. We're not impacted by the government shutdown. Congress has been generous, as you know, and VA has a budget. So there's been no disruption in our provision of benefits and services, and you should continue to have high expectations for our programs. But if you're a furloughed federal employee with a VA debt, you can ask for a suspension of the payment until April 1st by calling the number on the slide. This is findable, so I'm not going to repeat it. In addition, if you have questions or concerns about any of the benefits, here are the numbers, and I know you can replay or find these to ask for assistance or have general questions. So the purpose of this slide is to let you know, yes, we are in fact in business still. Next slide. Just to kind of recap, the VBA provides benefits and services to veterans, and these are the benefits and services they've earned. And quite frankly, they can help our veterans reintegrate into society as well as accelerate based on the fact that you have these benefits. You heard Dr. Stone earlier mention the vast size of the VHA. We're somewhat smaller, about 24,000 employees last quarter, 57% of whom are veterans. And so as everyone's talked about, from the Secretary on down, we see it's very important that veterans are serving veterans. We're located nationwide. We have 56 regional offices and other special processing and call centers. And last quarter, we administered $22 billion in benefits. Our programs are listed here, and I'm not going to go through each of them, but just make a couple observations. One of them, I'm often surprised, even the most knowledgeable veteran, of awareness or lack of awareness of the wide range of our programs. So even if you think you know all about what VBA has to offer or what you've earned during your service, please take a look at our website to learn about all the programs. We'd never a chance when we interact with someone say, gee, I did not know I was eligible for these kind of things. The other thing is the combination of these benefits and how they can work together to think about your future well-being based on your service. It's easy to understand if you've earned the GI Bill how education can transform your life, but the combination of them can really be powerful. For example, we hear lots of stories at VBA about folks who have purchased a home using the home loan guarantee, build up equity, and use that equity to run a business, and that has vastly transformed their life. So again, please learn about these benefits and understand they're yours to access. Next slide. Just to go directly at one of the things that we've been dealing with is the Forever GI Bill implementation, and I want to talk about that because we have had some challenges and remind everybody about how we're dealing with them. In the fall, we struggled to implement two final provisions of the Forever GI Bill that dealt with housing and repayments. The struggle resulted in us setting an implementation reset to really reflect and replan on how to get this right. So the new deadline for implementation will be December 1, 2019. When we've done that, we will go back and make sure everybody gets retroactive payments that they are due starting in August 1st when it should have been implemented. So our commitment is that once properly implemented, everybody will be made whole. And at the bottom of the slide is the quote from the Secretary saying, we will in fact do that. There are no special clauses in the language or exceptions. We are going to do that. In addition, in the fall, we were using the wrong rates to pay folks. We were using the 2017 school rates instead of the 2018 rates. We committed to fixing that, and we promised that would be done by January in 2019. With very few exceptions, we completed that in December, so folks should have got, I'll say a check, but a lot of it's electronic transfer to true that all up. Going forward for the spring of 2019, which we're in, it began actually late last year, we are processing enrollments on time. But again, if you have any questions or issues or hardship situations, the number's there, and I'll repeat, 188-GI-BILL-1, 1-888-GI-BILL-1, and we'll be able to take your questions and work with you on those special situations. In terms of a summary of what's gone on at VBA this quarter, our production for the different programs we administer, they're all on target. terms of the budget we get, we are on target in that too, so we're tracking. We've engaged last quarter in an awful lot of oversight and transparency. We've dealt with the Hill and the Senate, the House and the Senate, providing them the information they need to make sure we're following through on the promises, as well as dealing with GAO directly to work to get off some of the things they pointed out that get us on what's called the high-risk list. In addition, we've rolled out the new Office of Transition and Economic Development to support transitioning service members, and we held a kickoff event in Puerto Rico where we provided a claims clinic to educate up to 900 veterans in the area on their benefits. We actually hired, because VBA has a big presence there in a regional office, 70 new employees for our call center and the office, and we combined with VSOs to actually come down there and do Habitat for Humanity-like things to invest their own money to rebuild properties for our veterans. Again, as I pointed out, we're addressing the GI Bill, as I indicated, and we're working closely with Chairman Mason on Appeals Modernization Act implementation. She's going to talk about that in more detail in a minute, I'm sure. So thank you very much, David.
Thank you, Dr. Lawrence. Now we'll hear from Mr. Reeves, Undersecretary for Memorial Affairs.
Thank you, David. The National Cemetery Administration is honoring and caring for our veterans and their families every day. Just this past Monday, as many parts of the country, including the Northeast and the capital area, were hit with a severe winter storm, I was honored to be at Quantico National Cemetery when American heroes were laid to rest. The team there was in at 3 a.m. to clear roads of snow and prepare for a full day of interments. All our cemeteries were open and honoring America's veterans on that day and every day. This is what Ncaa's team does every day for our veterans and for their families, whatever the weather or other conditions may be. It is my honor to participate in this town hall and share with you what the National Cemetery Administration is doing across the country to serve our veterans and their families, and to also talk and hear about what VA as a whole is doing to serve our veterans in even more ways than ever before. In Ncaa, we continue to have three very straightforward priorities. One is to preserve the legacy and to ensure that no veteran ever dies. You've heard me say before that every person dies two deaths. We die for the very first time when breath leaves our body for the last time, but we only truly die sometime in the future when no one speaks our name or tells our story. That is our vision and sacred mission, to ensure our veterans are remembered and that their stories are told in perpetuity. Our second priority is to continue to provide access and make sure that we are doing our very best in honoring veterans, so that our veterans and their families will choose Ncaa and also continue to choose VA. We could not do what we do without our third priority of partnering to serve our veterans. We partner with foundations, local veteran service organizations, other agencies, states, tribes, and our local communities. Without this support across the nation, we could not do what we do every day. Over the past year, I visited over 60 cemeteries and have been to many other VA sites where veterans are being cared for. It doesn't matter if I am the Undersecretary for Memorial Affairs or whatever role our leaders may have within the VA. People see us as the VA and the people who serve them. My colleagues and I interact with veterans and help them get the services they need, whatever that may be. Over the coming months and looking to the future, we will be bringing online new cemeteries that will provide more and more access. We expect to deliver and complete construction this year at Fargo National Cemetery in North Dakota, which is one of our rural initiatives. We will begin construction on a new urban initiative in Indianapolis area at Crown Hill, which just this past Monday we closed on that land. We're also in the process of constructing another cemetery, which is a rural initiative in Rhinelander, Wisconsin. We are consistently working on other sites and expanding our existing cemeteries to ensure that our veterans have the access and the service that they have earned and that they deserve. As we move forward, we are increasing the number of veterans who are covered by our services within 75 miles of their home. Not long ago, I had reported that we had increased access to over 93%. That means over 93% of our veterans have a burial option within 75 miles of their home, and we are well on track, especially with these initiatives and expansions that I've mentioned previously, to increase that to 95% within the next couple of years. This year, we began the implementation of the President's initiative to transfer 11 Army cemeteries to the care of Ncaa. We expect to complete the first transfer soon, with others following this fiscal year. Our work with the U.S. Army as one of our major partners has been so important, and we appreciate the work they have done and continue to do to make sure we are able to carry out this initiative to care for those who have served our nation. There are some pictures being shown on the screen, and those are representative of our engagement in communities across the nation. As I said, I've visited over 60 of our national cemeteries in the past year, and I visited many of those within just this last quarter, all the way from the Pacific up to Vermont and our northern states, and all the way down to Texas. My senior leaders and I are in the field all across the country because that is where veterans live, and that is where we are committed to providing the care and service that they need. I must thank the team members of Ncaa for their outstanding work in carrying out our 3 priorities, and I must also thank the entire VA team for the work they do serving veterans each and every day. Thank you, David.
Thank you very much, Mr. Reeves. And our last guest, Chairman Cheryl Mason, Board of Veterans Appeals.
Thank you. First, I would like to thank Secretary Wilkie and Dr. Davis for inviting me here today to talk about VA Appeals modernization and the changes happening at the board. As chairman of the Board of Veterans Appeals, I lead a team of over 1,000 personnel, including judges, attorneys, law clerks, and administrative professional staff, whose mission is to conduct hearings and decide appeals in a timely manner on behalf of the Secretary from all 3 administrations, Ncaa, VHA, and VBA. In 2018, the board issued a record high number of 85,288 decisions, which was 62% more decisions than in 2017. This is due to the hard work of our personnel. For 2019, we are on track to exceed that number. The current appeals system that we have is complex, non-linear process that is confusing for veterans and takes much too long. In March 2016, VA met with VSOs, Congress, and other stakeholders to create a new appeals process that gives choice and control to our veterans. In 2017, the Appeals Modernization Act, known as AMA, was signed into law by the President and will be fully implemented, as you heard the Secretary announce earlier, in mid-February 2019. AMA will reduce the time it takes for veterans to receive their decisions, and most importantly, gives choice and control to our veterans about their claims and appeals. Veterans will have 3 choices as to how their claims or appeals are handled, 2 of which are at the claims agency level. The first is a supplemental claim lane, where a veteran can submit additional evidence. The second is the higher level review lane, where a more experienced reviewer, at VBA for example, will review the record with the same evidence. And the third lane is an appeal directly to the board. There are 3 lanes at the board, and those are covered on the board website. It is the direct docket, the additional evidence lane, and the hearing lane. If a veteran chooses to appeal to the board, he or she must choose one of these dockets, and these are explained in much more detail on the board's website. To prepare for implementation, there were many trainings for board staff, our veteran service officers and advocates. Myself and members of VBA and others were out training our VSO and advocate partners. We also received feedback. In alignment with my priorities of service, action, and modernization, the board has worked with OIT and Digital Service to improve the board's outdated technology and reprioritize the technological changes for AMA. Additionally, the board responded to veteran suggestions and restructured the decision so that the bottom line of the decision is now the first things our veterans see. Veterans can also check the status of their appeal via the Appeals Status Tracker, which is updated daily on vets.gov. Additionally, the board hired an additional 200 personnel this year, many of which were military spouses, and the board is the only member in VA of the Military Spouse Employment Program, something as a military spouse myself I am very proud of. Appeals modernization will provide faster decisions, gives more choice and control to veterans, and advances the Department and the Secretary's priority of providing excellent customer service by our employees to veterans and their families. For more information about appeals modernization, the board, or to view the appeals status tracker, please visit the sites listed in the slides. Thank you.
Thank you very much, Chairman Mason. Now we're going to address a few questions that were submitted to us over the previous month from our Community Veterans Engagement Board. The first question is for Dr. Lawrence. Dr. Lawrence, how is the VA protecting veterans against predatory practices for cash-out finance loans? And can the VA help with cash-out refinance loans to refinance a non-VA loan into a VA loan?
Sure, this is a great question and very topical. Cash-out refinancing, or cash-out refi, as we talk about it, can offer many benefits to a veteran. But previously there have been limited rules around it, which has led to some of the predatory practices the question hints at. So we've taken steps to begin the process to implement rules around it. So let me explain. Cash-out refi is a way for a homeowner to access the equity and withdraw it to use for other things, perhaps remodeling, perhaps financing college, perhaps paying down other debts. So let me give you an example. The house is purchased for $100,000, but over time it becomes worth $150,000. With the cash-out refi, the homeowner, the veteran, can access that $50,000 to, say, remodel the kitchen. We want to make sure there are rules around how often this can be done, if the veteran clearly understands the benefits they're supposed to receive, as well as financial disclosure by the lender. So when the veteran enters into this, they really do appreciate the financial situation that it brings. It has possibilities for benefits, but also can cause some problems, which is what we've seen. The answer to the second question is yes. They can use this to finance a non-VA loan, and VA will guarantee 100% of it. So yes, it's a very powerful tool that can have some problems, and we're implementing rules to make sure it only works for the veteran's benefit.
That's really good information. I've had a VA loan for 30 years, and actually that's the first time I've heard this, so excellent. The next question we have is for Mr. Reeves. What does the Ncaa do to support state and tribal governments that manage veterans' cemeteries?
Well, we have our Cemetery Grants Program, which is managed by the National Cemetery Administration. Through that program, state and tribal governments can apply for a 100% grant to build and outfit a cemetery that may be needed in their area, or in most cases, it's an unserved area. I want to point out that that program itself is one of the major factors, and our states and tribal governments are major partners in our ability to be able to expand access to all of our veterans across the nation. I talked earlier about the fact that we are going to reach 95% coverage of our veterans very soon within 75 miles of their homes. We couldn't do that without our state and tribal partners and that state cemetery grants program. In addition to that, during the life of their cemeteries, they can apply for expansion and improvement grants to help upgrade and expand those cemeteries as they move forward. Anyone or states that are interested in that or in that program can go to our website at www.cem.va.gov, and it is displayed prominently on our site. And they can also contact us, and we'll be more than happy to give any information they need. But we have state cemeteries in addition to those national cemeteries that I was talking about that are being constructed and coming online each and every year.
Thank you very much. Chairman Mason, the next question is directed to you. Greetings. I have been waiting on an appeal since 2015. Last June, I opted for the RAMP program, Rapid Appeals Modernization Program system. But as of today, nothing shows up as an update. How much longer does this process take? And thank you.
Thank you for that question, David. The RAMP program, Rapid Appeals Modernization Program, that VBA is currently running with the board. VBA is currently doing those cases in approximately 125 days. In this case, I would encourage that veteran to reach out to their local regional office and check on the status of that with the leadership there.
Thank you very much, Chairman. Next question. Looks like back to you, Dr. Lawrence. This is kind of a combined questions. We had two that are similar, so I'm going to pose them together. What can you tell us about legislation for presumptive conditions based on Agent Orange exposure by Blue Water Navy veterans? And the second part of this question, Do you see coming legislation for presumptive conditions based on burn pit exposure?
Sure. Let's kind of start high level on this and then go into the details of legislation. If a veteran is injured or needs medical care for something, Agent Orange exposure, they should, think about accessing the health care that we can provide them, because our goal is to get them well. So let's talk about what's really behind all that. If they feel they're in need of, they can file a claim, they can do that, and we evaluate all claims on a case-by-case basis. So let's start at a high level what our real goals are. In terms of presumptives, those come with, a real requirement of sufficient evidence to indicate it's warranted. So this was introduced, the Blue Water Navy legislation was introduced in the last Congress, and our position was that we were opposed to that because the scientific evidence around the causation was not clear. We understand the situation, and so we talked at that time about having more studies that would come up in 2019 that would give us more insight into what the causation was and the definitive conclusions behind it. So again, the legislation has been introduced, the study should be percolating on, there should be more on that. But our position is it must be supported by science, because that really helps all veterans as well as us adjudicate decisions. The burn pits is sort of the next evolution of exposure-based injury. So let's talk about this. Again, veterans are welcome to, encouraged to apply for benefits on a case-by-case basis. And on burn pits, a couple things. We have a burn pit registry where veterans are encouraged to go and sort of indicate, yes, I'm one of those people, so that we can track them and be aware of that. But also, we've granted benefits to folks on burn pits based on their case. So the presumptives, aid some of this, but come with a high degree of evidence, in our opinion. More studies are being done. That will inform us. But anybody's welcome to apply for, any veteran's welcome to apply for benefits, and we will look at that on a case-by-case basis.
Outstanding. Thank you very much. I know that it's a hot topic. We received numerous questions on that. The next question is for Mr. Reeves. Does Ncaa partner with other federal agencies?
Well, as a matter of fact, we do. Thank you for that, David. As I mentioned earlier, we are currently working with the United States Army to transfer 11 cemeteries that are currently under the care of the U.S. Army to the care of the National Cemetery Administration. In addition to that, the Army and other DoD components operate some post cemeteries and that, and they also, other agencies, for instance, like the Department of Interior through the Park Service, operate cemeteries that are mostly historical cemeteries, but we provide support and training also to those agencies, and also through our Memorial Product Services Division. We also provide headstones and other items that they may need. In addition to those kinds of partnerships, we partner with the American Battle Monuments Commission through our Legacy program, and we, because our commitment to make sure, or to ensure that no veteran ever dies, extends to all of our United States veterans, not just those that are buried in our national cemeteries. It wasn't long ago, this past summer, that we did a partnership with ABMC, the American Battle Monuments Commission, where we sent educators through our Legacy program to actually spend time in Europe in their cemeteries to document the service and the sacrifice of veterans who were buried in those cemeteries, and that's an ongoing partnership. We also work with the National Archives, and we work with many others on access to information about our veterans and information sharing. The list can go on and on, but we work with people just as our other partners in VA do across all agency lines to make sure that we are honoring and caring for our veterans.
Thank you, sir. Chairman Mason, back to you again. And this is a similar question to the previous one, but in the last town hall, we had a lot of questions that were on appeal, so it's not a surprise that we have these for you. I've been fighting a claim for the last 14 years. The claim is still in process and awaiting a VA appeals office. I've been told the process can still take 3 to 5 years. Is there a faster way to get this claim settled?
David, that's a great question. And this is exactly why we have appeals modernization. This is exactly why our partners came together, and this unique opportunity where we came together and created the appeals modernization program. The appeals process goes through, if you want to use, for example, Veterans Benefits Administration, and there are steps that it has to go through before it gets to appeals status at the board. That can take a long time, and there are things that happen along the way. There's a variety of timelines, anywhere from 60 days to a year, depending on when the veteran has to choose about how they want to move forward with their appeal. The faster opportunity exists right now, and that is the Rapid Appeals Modernization Program that VBA is running, and the board just started adjudicating appeals in that process. VBA has been very successful in running this program. They have received over 70,000 appeals moving in out of the appeals process into RAMP, and they are working forward to adjudicate that. So I would advise anyone that if they have the choice right now to opt into RAMP. Please be advised, though, that once the new law implements in February, as the Secretary noted, which we will implement in on or about February 19th, 2019, the choices will then occur to opt into the Appeals Modernization Program at the SOC, Statement of the Case level, or Supplemental Statement of the Case level. So those are the opportunities to speed it up.
Thank you. Mr. Reeves, how do I do my part to help remember veterans that came from my local community?
Well, I would say this very simply. If a person is a veteran, or if they're a person who has veterans that they know, the first thing you can do is tell that veteran thank you. That's how you can honor veterans in a very special way, to thank them for their service and for their sacrifice. Also, a best way to get is to get involved in their communities. There are a number of events that are going on all over the country all the time. One of them, for us in the National Cemetery Administration, is Wreaths Across America. It's done by a private organization, but people can get involved and go out and help lay wreaths on those headstones on those cemeteries across the nation. Also, at our cemeteries, we have support foundations and support committees that are there to both raise money for events and to also participate in events that specifically honor veterans. And I know that across VA, whether it's in VBA, whether it's in VHA, there are events that go on all the time where veterans are honored. Show up and participate and tell our veterans thank you. Even if you are a veteran, tell our brothers and sisters thank you for their service and sacrifice.
I'll take the opportunity to thank both of you for your service. One of the next comments we have, it's not a question, it's a statement that bears some interest. And let me read this. It says, one of the 30,000 foot view questions I have has come up a few times in meetings that I've participated in is the overall role of VA in transition. I don't think there's any argument that the VA's area of expertise is healthcare. But then the question pops up about the role of the VA in transition from military service to civilian life. I think one attitude that the VA should play is a role for veterans' lives for the rest of their lives, whether it's healthcare, employment, behavioral health, or any numbers of issues. After all, the VA is the government agency specifically designed to deal with veterans.
So let me address that, please. Because from a VBA perspective, we couldn't agree more with this. And let me explain. This is one of the reasons why we created the new office I alluded to in my opening comments called Transition Economic Development, because we want this office to collaborate with federal partners, other organizations that are working through the transition process, because there's so much out there that we need to figure out how veterans learn about benefits and understand that it's a lifelong journey. So Dr. Davis in her comment talked about how we get information into the DoD-run program called TAP, Transition Assistance Program. We want benefits to be part of that. It's a small part of it now, but we know that often what happens is veterans sort of hear the information and later really understand it and want to know more. So we know the explanation of benefits is a lifelong process as well. And you know, you just made reference to our service. I mean, something we think about, and I'll close on this point, is, you know, I was in the Department of Defense as an officer in the Army for 3 years. but I've been a veteran 10 times longer than that, okay? And so we think, the veteran experience is powerful and it's lifelong. And so we need to better understand how we are constantly reminding them of the connectivity to us, what it yields in terms of, the benefits VBA administers, the access to health care, the connectivity that was talked about around things like suicide and that we're the long-term investment.
So we have time just for one more questions, and it's a pretty generic one. It's going to go to Chairman Mason, but I don't understand. How do I make an appeal to a board?
Okay. Well, currently, the appeals process is, as I said initially, is very long, it's very complex, and it's what we call a spaghetti mess. Currently, the veteran, you would apply for a claim, you would make a claim, you would receive a decision, primarily from VBA, because that's the biggest organization that most of the veterans work through with claims. Then you would have 1 year to file a notice of disagreement. After that 1 year period, or within that 1 year period when you file that notice of disagreement, then the Agency of Original Jurisdiction would issue you a statement of the case. After you receive your statement of the case, you have 60 days to file an appeal. And at that point, you can have the choice of having a hearing or not having a hearing. And once you file that appeal, then the case gets in line at the board. The board, under the law, has to work the cases in docket order. And so that's what happens. Then it comes to the board and it waits. What the beauty of appeals modernization and what we really worked on with our colleagues and our stakeholders was to skip that process. Under appeals modernization, which will launch in February, the veteran has 3 choices. When they receive that initial rating decision, let's say for example from VBA, they can stay within VBA and have VBA look at it, just look at the case as a higher level review, look at it again, is it right, is it wrong? Or if they understand that they need additional evidence that they hadn't submitted before, because they're going to get a very in-depth, clear, veteran-focused letter that explains what they were missing, they can ask for a supplemental claim and submit that additional evidence. Or